talk about the pandemic. It never goes away, according to Dr. Anthony Fauci, and nothing ever gets better. He's still cautioning vaccinated Americans against indoor dining.
Eating and drinking indoors in restaurants and bars, is that okay now?
No, it's still not okay for the simple reason that the level of infection, the dynamics of infection in the community are still really disturbingly high. And if you are vaccinated, please remember that you still have to be careful and not get involved in crowded situations, particularly indoors where people are not wearing masks.
It's exasperating. How will the mixed message impact businesses just trying to recover? Is that a responsible statement? Let's bring in Fox News contributor Dr. Marty Makary. Dr. Makary, we were told last week by the CDC if you're vaccinated, you can't transfer the virus. We were told you can't transfer the virus from objects, inanimate objects. So we're wiping down our groceries for no reason. We should not even have to wear masks, let alone telling us not to go indoors. Was that totally irresponsible?
Well, good morning, Brian. You're hearing a lot of mixed messaging, and as a result, a lot of the medical officials are losing credibility, and we're seeing the infection right now spread in 5 states among young people, and I think that's because a lot of the guidance has lost credibility. Look, the Israeli study is in now. Our own NIH, Dr. Fauci's NIH, did not fund these studies looking at transmission, but now we don't have to guess. The data is in, and the risk of transmission from that Israeli study is negligible. And I can tell you, Brian, as a doc, you got to give people something to look forward to.
Absolutely.
If you just tell them they can't do stuff, it's not right. You got to tell them how to do things safely and be in step with what they're going to do.
Dr. Makary, when you have a medical doctor on, you should have a psychologist on too. Because also, look at a behavior, anyone studying behavior. If I'm going to a bar and I got to leave at 11 o'clock because we know the virus only spreads after 11, I go home, where we've been told that in-home spread is the bigger problem, correct? Do people want to ever game plan this out?
We're about to enter a big national argument, and that is when the hospitals have basically no COVID patients, but the virus continues to circulate among young people who tend to have asymptomatic infection or very mild symptoms. Is that a health emergency or not? And you're going to see a national argument break out over the month of May over that, because that's probably what's going to happen over May. So there's trade-offs. It's not a matter of we're being overly cautious as if caution is good. There's trade-offs. And let me know if you ever hear Dr. Fauci or Dr. Walensky ever talk about suicide from kids getting shut out, from businesses being starved, or from the harm of profound isolation. They don't talk about that.
Let me throw a stat at you. In March, employment in eating and drinking establishments, restaurants, bars, 1.8 million jobs below pre-pandemic levels. We got 74 million people fully vaccinated, 22% of the population. Over, I think on Saturday or Sunday, we got 4 million in one day. Yet we still have our medical officials walking around with 2 masks. What kind of incentive is that to get people who are on the fence to get vaccinated? What changes? I still have to go home and sit alone with a double mask.
Look, let's make it very simple. You get your vaccine, you wait a month for that immunity to kick in, and live a normal life.
Thank you.
Now, if some business wants to have a mask policy for an indoor public gathering, just respect that for a few more weeks until we get to a better spot. But live a normal life, and that's why people should get vaccinated, and that's how we're going to deal with vaccine hesitancy, liberate people.
Don't tell us that you cannot shed the virus once you're vaccinated, and then tell us don't go anywhere, don't go to an establishment. Do you know how many restaurants are losing zillions of dollars because of this arbitrary 11 o'clock curfew? And then you have America's doctor who has a doll of himself out there circulating, which he thinks is hysterical, tell us not to go to those places. Do you know that people have leases due? Restaurants want to hire employees. They order food. And then you have Dr. Fauci telling people to stay home. That's totally irresponsible.
Well, I will tell you, Brian, I don't think it's representative of how everyday doctors think. A small group of people are making all the decisions here, and they may be really good at virology, but they don't know anything about implementation science, about public policy, about poverty, about education, and they don't know anything about rationing. We haven't done a great job rationing the scarce resources.
Dr. Makary, thanks so much. Appreciate it.
Thanks so much, Brian.
All right, straight ahead. Fox News alert. A deadly mistake claims the life of a 20-year-old in Minnesota, but calls for due process are falling on deaf ears. With unrest overnight and a community on edge, we'll ask our police panel about what comes next.